And welcome back. We have with us this morning Dr. Sheetal Patel. We're so glad to have you this morning.
Thanks for having me.
Thank you for coming. And I never say to a doctor, thank you for getting up early to be here. I don't have to worry about that. Other people say, oh, you get me up so early, I don't have to be at work till 9 or 10 o'clock. Well, that's not true for Dr. Patel.
That's not. We're used to getting up in the middle of the night.
Yes,
so
I didn't
okay.
feel guilty this morning. But anyway, Dr. Patel is a cardiologist,
Correct. Interventional cardiologist.
I said it right.
Yep.
Cardiologist with UNC Health Nash. And we're so glad to have her here for part of our New Year, New You segment. And our hospital realizes the importance of keeping you healthy. And that's their focus. So much of their focus is education. And we're going to talk about that a little bit more as we go on. There's a heart fair going on.
Yes, we're having a women's heart health fair on February 3rd at Imperial Center between 10 and 2. The focus primarily this time is on women's heart health, but everyone's welcome. We'll have information on nutrition, exercise, hands-only CPR. We also will have lipid check and cholesterol check for patients so they can somewhat get a baseline, see whether they need to make any lifestyle changes.
Well, a lot of people, Dr. Patel, don't go to a doctor. They're, maybe they're middle-aged, younger age, and just have, and then they find out, my cholesterol, oh my goodness, I need to get a checkup.
Yes.
So,
most of us don't like going to doctors. Including me. I don't want to go.
Yeah.
The issue that we try and focus on is preventative medicine is better than having to treat disease processes. So.
I totally believe in the prevention.
So we like to make sure that we catch patients early enough. We want to make sure that we're managing their risk factors so that problems don't go to a point where they actually have to wake me up in the middle of the night to take care of them.
Absolutely, absolutely. So heart disease is just so prevalent in our area. Well, all over the United States. I mean, our country is.
Yes.
What is heart disease exactly?
So heart disease, people normally think of heart disease as someone having a heart attack. Yes, that is part of it. But remember, your heart is not just coronary arteries. You can have heart disease because you have a rhythm problem. I think of a heart as a house with 4 walls, meaning the walls of the heart, valves being the doorways, the electrical system, and the plumbing. Any of those things can go wrong. So if you have issue with valves in your heart, that technically is heart disease. You have issues with the squeeze of the heart, the strength of the heart, that is heart disease. You have arrhythmias, people have atrial fibrillation, people have SVT. These are electrical issues. And what I do primarily is take care of coronary artery disease. I like to call myself the plumber of the heart.
Right.
But all of those do count as heart disease.
And see, we don't realize that. I think we think of arteries as heart disease.
Yes.
But it's not just arteries.
Absolutely.
It's not. And yes, just like in your house, a plumbing system that's not working well can affect the rest of your house.
Right.
But that is not the only thing.
Okay.
What we do, our lifestyle does matter, and it does affect all aspects of your heart, some more than the others.
Right, sure.
But it does, and it's important to understand that just because you have problem with one part does not mean you have a problem with another, and vice versa is true. Just because you have a problem with one doesn't mean it's going to stay there. That problem with your heart problem, whatever that may be, can cause other issues with your heart and your health in general.
Right. Well, how much of a role does family history play with heart disease?
A big role. I like to joke about the fact that I've tried to get new parents. It doesn't work. Too bad we can't pick our parents.
Right.
Family history does play a big role, but you have to keep in context of the health of the family member themselves, right? So, if dad was a smoker, ate unhealthy, was overweight, did not exercise, and had heart disease at 40, that does not mean that a 40-year-old who's running marathons and eating vegetables all day long is going to have a problem at 40.
Right.
family history does play a role, but that does not mean that you need to hasten that heart disease. That does not mean that you have essentially a death warrant written for you. You
Right.
can do things to delay that disease progression if you are going to have it. But it does play a big role, and it is important to know that there are things that we can do to help prevent that as
Yes.
well and manage that.
Well, if you know, Dr. Patel, that you do have this in your family, then that's all the more reason that the prevention really kicks in big time.
Absolutely. Absolutely. You know, I have a huge family history of heart disease. Yes, my sister and I make a morbid joke about, having heart attacks in our
Right.
50s. But that does not mean that we have said, oh, well, I'm gonna have it, so might as well just,
Right.
just be quiet about it and do nothing about it.
Right.
We have both decided to live healthy. We try and exercise as much as we can, and whenever we get an opportunity, we eat healthy. And it's not just that. It's not just taking care of your heart. Taking care of your health in general
Absolutely.
is important, right? Not drinking too much, not smoking, just being healthy
Yes.
in overall actually does affect your overall heart health.
Which brings me to risk factors.
Yes. So there are risk factors that we're born with. Age. Can't stop aging.
Right.
That
Absolutely.
adds to your risk. Race. African American, Latino, Indians from India, Pima Indians, we tend to have a higher prevalence of heart disease. Can't change that.
Right.
Cannot change the fact that mom and dad had heart disease without any eliciting or high risk factors. Those things we cannot change.
Right.
Things that we can change: high blood pressure, managing our blood pressures,
Right.
diabetes, managing our blood glucose,
So
exercise.
diabetes and high blood pressure are just can be directly tied to heart.
Correct. As a matter of fact, diabetes is considered heart disease equivalent. So when I
Wow.
calculate risks for someone, if someone has diabetes, that is just as bad as you having heart disease.
Wow.
So it's a huge factor, but high cholesterol, lack of exercise, not eating well,
Right.
our diet in South of very much the meat and potato and
Yes.
fried chicken.
And we love
as
the
delicious
bacon
as it is.
and the sausage and the fried chicken, like you just said. And
Yes.
we just love that too much.
Yes, and don't get me wrong, I'm sure it's all delicious. I'm a pescatarian. I primarily eat vegetables with some seafood here and there. I'm sure it's delicious, but you can either choose to enjoy it until you're 50 and then be sick for the next 20 years, or you can
Yes.
have it in moderation and be healthy, for 70 years.
Right.
And then I say when you hit 80, you can do whatever you want. So
It's one of those choices that we have to make for ourselves.
absolutely, absolutely.
Really is.
It's diet and exercise plays such a huge role. And it's not to say, well, I ate healthy, I exercise every day, and therefore I will not have a heart attack. That is not the goal. The goal is to prevent or delay disease progression, one, and two, God forbid, should you have a heart attack, you recover faster. The healthier you are prior to an insult on your health, the healthier you will be after that insult. And so it's more of okay, well, if I'm going to do this, if I'm going to have heart attack, then I don't want to be debilitated by it. I
Sure.
want to be able to bounce back and live my life.
Well, so if we know we need to exercise, what do you suggest? What are some good? I will admit, I always say I don't like to exercise, but I love to walk.
Yes.
So I'm of the mindset, if we do what we like to do and we pick something we like to do, we'll stick with it.
Yes.
If we do something we hate every time we do it, we're just not going to do it. I'm going to do that next week because I don't feel like doing it today.
Yes.
But if you like to walk, so what do you suggest for exercise as
Right.
far as prevention, I guess?
Sure. Exercising, so the reason why these health plans, diet plans, exercise plans don't stick, like you said, is
Right.
because they are not practical. They don't fit in our lifestyles, right? People come and see me. I tell them to become healthier. I tell them to eat vegetables and exercise, and they do. On their way home, they will purchase bag of leaves and say, I'm going to eat salad 3 times a day and I'm going to exercise an hour a day every day. And they do for the first 3 days. Day number 4 comes by and they say, I'm done with this. This is too boring. This does not work. I'm not doing this. The trick is to, like you said, find something that you enjoy doing.
Yeah.
American College of Cardiology, American Heart Association recommends 150 minutes of moderate intensity exercise. What does that mean? Brisk paced walking, swimming, lawn mowing, dancing, jogging, any of those, anything that will get your heart rate up, keep your heart rate up for a little bit, and then you stop. Which, 150 minutes a week translates to 30 minutes a day, 5 days a week. Or if you're someone who likes to run, then you can run, and it's 75 minutes a week, because that's a high intensity exercise. Or if you're a swimmer that likes to swim laps.
30 minutes a day is so minimal. I mean, if we think about it,
It is.
5 days a week, 30 minutes, I mean, for a better lifestyle.
It is. And as much as we all like to say, I don't have time to do this, I don't have time to do that, myself included, even I have 30 minutes a day.
Right.
And it doesn't have to be, if you cannot pull 30 minutes a day at one's time, 15 minutes a day, twice a day.
Yeah. It's better than doing nothing.
It's better than doing nothing, right?
Nothing.
The other thing people talk about is, well, I walk a lot at work. Well, that's great. Any activity is better than no activity.
Yeah.
But you want, for cardiovascular health, you want to be able to get your heart rate up and maintain it and not have issues with it to get your heart healthy. So if you're someone who enjoys walking, go for walks. From what I understand, Rocky Mount has wonderful trails.
Yes.
This area, the Triangle area in itself, has a lot of trails that you can walk. There are biking trails. If biking is something that you like, that's great. If swimming is something that you like, I know the local YMCA here has indoor swimming pool. Go swim laps. If you enjoy dancing, go dancing.
What a fun way to exercise.
Of course.
Absolutely.
Anything that'll get your heart rate up is a good thing.
Yes.
As long as it's with activity and not just sitting at rest.
Yes.
So exercise is important. Strength exercise, and people going to the gym is boring. No one wants to go to the gym.
Yeah. Me included.
Yes, myself included. If you can find something that you enjoy doing, it doesn't have to be the same thing every day, you're more likely to do it. If you find a goal that you want to achieve, it is easier, it's more motivational to work toward that. A fun goal, not, I need to fit an X, Y, and Z dress, which of course is an exciting goal in itself. But, I want to go to Disney World and I want to be able to walk all day and not have to rest. Or I want to go to Yellowstone National Park and be able to walk the whole park without having to rest or taking a car. Those kind of goals, you are excited about them. It's easier to achieve them. So finding yourself something that you enjoy doing and why you're doing it is important.
And I think if you do something, some of these things that you're talking about, I think we have a better mindset about ourselves.
Yes.
I'm doing something for myself. And it just makes you feel better than sitting there saying, what do I do? Woe is me. So, I just think it makes you have a better mindset to know that you are doing something about your health.
You're absolutely right. And not just that, the studies have shown exercise, releases endorphins. These are the feel happy hormones, right? Yeah. So you feel better with it. Believe it or not, there have been areas in the world that have been studied, and they're more popular in news these days, but we knew about them years ago. They are called the blue zones, where physical activity is part of everyday life. So if it is something that you can make part of everyday life, you are more likely to do it. You're more likely to feel better. Believe it or not, it helps delay Alzheimer's and dementia. People live healthier, not just longer, but healthier while they're living longer. And it makes you feel good. Makes you look good too.
Yeah, absolutely. We had a dietitian on the other day as part of our campaign, and she was saying, eat just enough meat that will fit in your hand. We eat too much meat, don't we?
Well, you're talking to a vegetarian, so yes. So, meat, I mean, there are philosophical reasons that people can quote for you, political reasons that people can quote for you. For heart health, meat should be a rarity. So, we recommend a pesco-Mediterranean diet. Mediterranean diet that has fish as part of it, meaning lots of fresh fruits, vegetables, nuts, lentils, legumes, beans, nuts, some fish. If you must have animal protein, some fish. And I'm talking about the salmons and tunas and the white fishes of the world, not the beer battered, deep fried kind of fish. Some dairy and poultry, chicken and turkey, and very little to no meat at all.
Right.
Someone who trained me used to say, if it ever had a face, don't eat it.
Right.
Which is,
okay.
That's perhaps a way to live. Though I do enjoy my salmon from time to time, so I don't know if I could go completely.
I love salmon.
Vegan, but
eating let the healthy. Cows live. She's saying.
Yes. It's. Prior to coming to Rocky Mount, I was in Texas, and I used to get people, and I would recommend the same thing, and I would have, well, but Doc, I raise cattle. Well, my answer to that, which is not very nice, is, well, you raise your dogs and your children as well. That is not the reason to be eating them. Healthier lifestyle really is the way to go. Again, I mentioned those blue zones earlier. What we noticed when we studied these blue zones is that exact thing, that these populations are not consuming red meat like we do.
Right.
They're primarily vegetarian meals with fish, in it, with some dairy, but really very rare amount of meat. And you will see, the idea that you must eat meat to get protein is a very Western idea. Right. Most of the world is not a meat eater world. Most of the world is vegetarian. It's convenient, and
absolutely.
There are political reasons for it, of course, and there are other reasons for it, but we're so used to it, it's hard to imagine our diets without meat.
Well, I'm so lucky that I'm a big vegetable lover. I love vegetables. If you give me a vegetable plate, and I could care less if I ever have a piece of bread. I don't care about that either. But I love vegetables, and I do like potatoes, but love vegetables. Got to have a little bit of starch.
Yes.
But carbs. But, vegetable, if you fill your plate up with vegetable, you can fill yourself up.
Yes.
On vegetables.
Yes.
You really can.
You can. And North Carolina is a very unique and wonderful spot where you have long enough summers to grow vegetables long enough. I know Rocky Mount has a wonderful farmers market on Saturdays.
Yes. Oh, I go every Saturday.
So much food. Yeah.
Yes.
You can buy a lot of these things and freeze them for the rest of the year if you wish to. If you're not someone who has a green thumb, you don't have to grow them yourself. Someone actually is doing the hard work for you. The trick is to find things that you like. One of the things I say to my patients often is, go try out food at a restaurant. Go try out vegetarian food at a restaurant. If you like what it tastes like, then buy the ingredients to make it at home.
Right.
Find things that you enjoy doing. Boiling the life out of vegetables is not going to make them taste good.
No, and I sometimes am guilty.
Remember, countries were conquered and fights were had. Wars were had over spices. Use them. People died over them.
Wow.
So
that's a pretty good thought. I hadn't thought about it that way.
Yeah.
But
there's so much available these days. You don't have to go halfway across the world to get these spices. You can go to Harris Teeter's and get them, and you won't know what you like unless you try it.
What if someone says to themselves, "Oh, I want to know how much my arteries are, how my arteries look." You don't just have a heart catheterization just to find out, but how do you know where you're at?
If you can exercise, when we do our stress tests, and we don't recommend stress tests for everyone. When we were to, I were to make you do a stress test, if you can walk for 9 minutes and not have any issues, you're fine.
Really?
Yes.
9 minutes?
Yes. Now remember, back in the day where we used to say, well, I just want to see, is no longer recommended. We no longer go out and look for problems where none exist.
Okay.
So again, what guides testing is how you feel your symptoms.
So you got to be in tune to your body.
Correct.
You really do.
Correct. And the only way to do it, only way to know if you have issues, is to actually be active. Because if you're not active, you will never know if you're having chest discomfort when you exert yourself. You're never going to know.
Point. What a good point. Yeah.
So
You've had
it's
so many good points.
It's not just to stay healthy, it's also to know if you are healthy.
And we will close with why. So women's heart health is different than men's heart health.
Yes.
Why?
Yes, I am so glad you brought it up. So women's heart health is really a special thing for me. It's near and dear to me. For years and years and years, all the studies that have been done have been, even now, a majority of the participants are males. The classic, elephant sitting on my chest, the picture of the middle-aged white male that you see is no longer the population. It never was the actual population, right? But that's what all the studies were done on. What we have discovered over the years is that classic symptom is not necessarily what women present with when they're having a heart attack. Women, as being subtle creatures as we are, we tend to have symptoms that may be subtle as well. We may present with just shortness of breath. We may present with indigestion that feels like indigestion, but everything that you've done to help with indigestion that has worked in the past no longer works. Women may present with flu-like symptoms that just happen all of a sudden, not flu that gradually got worse, but one day you were doing something and all of a sudden you just felt worn out and then you did not really recover after that.
Wow.
Symptoms for women are subtle, not necessarily classic. That is not to say that they cannot have that elephant sitting on the chest kind of symptoms. But the symptoms are more subtle. If you have the risk factors, if you're diabetic, if you're overweight, if you're a smoker, if you have high blood pressure, if you have high cholesterol, and you're having these symptoms, you need to think about that twice. You need to present yourself to an emergency department, to a doctor. I cannot tell you how many women I've taken care of that ignore their signs and then come in a month later. At that point, the damage may already be done. So the focus for Women's Heart Health, this fair that we're doing on February 3rd, is to help educate women and men, because every man has a woman in their life.
Yes.
Mom, dad, mom, sister, wife, daughter, whoever. It is important to educate that because we're still missing that piece of the equation when we're talking about healthy community, healthy societies, because again, 50% of our population is women.
Right.
And we're ignoring a big chunk of that.
Yeah, sure.
So the goal for us is to raise awareness to make sure our women part of the community, the 50% of the community,
Yes.
that's really, in my opinion,
The important part of the community. I'm sorry.
Thank you. That I just was about to say that I may be a little biased, but the part that runs the world needs to be better taken care of.
Absolutely.
And since heart disease is the first two leading causes of death in population over 40, I think it's important. I think it's important that the scale tipped in the other way and we focus more on women's heart health than just men's.
Well, I think it's great that UNC Health Nash does this. You've done it many times. Y'all have had a health fair many times. This year it's at the Imperial Center downtown. Everybody knows where that is. Don't go to the hospital this time. Go to the Imperial Center.
Yes.
And it is February 3rd, and the hours are
10 to 2.
10 to 2,
Yep.
4 hours. And you can get your screenings done. It'll just some very valuable literature will be passed out,
Yes,
I'm
we'll have
sure.
literature. We will have a sampling of heart-healthy foods.
Yes.
We are doing a couple of giveaways as well. We have some
Okay.
prizes. I know we have a fitness tracker and a few other prizes. We'll have information. We'll have recipe cards. We'll have people. We'll have physicians that you can speak with. We will have our local. Couple of our local gyms. We'll have nutritionists there. We'll have our EMS teams there. We'll have the city of Rocky Mount there,
Right.
to help educate the population about what recreational and exercise areas are available. A lot of information, a lot of people. We're all dedicated. We all want to be there, and we want to make sure that we're healthy.
Well, we will continue to remind you until February 3rd on the morning show, 10 to 2. Please come out to the Heart Fair. We really encourage you to do that. And if, it's a women's health fair, but men, you are welcome if you
Yes.
want to come.
Yes, men, children, bring them all.
Yeah,
The
Bring
sooner we
everybody.
start, the earlier we start, the better it is.
very good. Well, we hope to have Dr. Patel back in February. It is Heart Month, so we have to bring
Yes.
Dr. Patel back in February and I want to talk about some of the services and some of the procedures that you do and what's available here in our town. We
A lot.
shouldn't have to go out of town for everything. I mean, we have so many resources right here
Yes, we do.
in our community, so we'll talk
We
about
sure
those
do.
maybe in February.
Of
So-
course.
Okay,
course.
thank you so much.
Thank you.
Enjoyed it so much.
you.
And we'll be back right after this.